Thank you all and good afternoon. I'm joined here today by Minister of Health Adriana LaGrange, Minister of Jobs, Economy and Trade Matt Jones, Panel Chair Rick Hansen, and Dr. Laura McDougall, Senior Medical Officer of Health at Alberta Health Services, for an important update on work we're doing to improve food safety in childcare settings. Last fall, families in Calgary experienced a living nightmare, an E. coli outbreak affecting 17 licensed childcare facilities around the city. More than 400 people, mostly children, became ill during the most serious E. coli outbreak in Alberta's history. 39 individuals were sick enough to require hospitalization, and some of them are still requiring long-term health support as a result. Thankfully, families were spared the worst. There were no deaths resulting from this outbreak. But while the situation didn't end in deaths, we do recognize the devastating impact it had on those who were affected by it. The children who got sick and their family members who suffered the pain and anxiety of watching their loved ones fight for their lives. Some impacts are still being felt today, almost a year later. When parents put their children in daycare, they do so trusting that their kids will be cared for and kept safe. And that's because we have systems in place to regulate and monitor health and safety practices in licensed facilities. We know this outbreak has shaken that trust, and as policymakers, we must do whatever we can to ensure this doesn't happen again. During the crisis, our top priorities were looking after the people who got sick and tracking and containing the source of the outbreak. But we also recognized that we needed a clearer understanding of how it happened. That's why, as the crisis was unfolding last September, I called for the creation of a review panel to get to the bottom of what caused the outbreak and to ensure the policies are in place to hold operators accountable and to prevent it from happening again. The review panel, led by former Calgary Police Chief Rick Hansen, was made up of childcare operators, a food service operator, and subject matter experts, including a pediatrician, who treated some of the children. Their task was to conduct a comprehensive review of the government policies and food safety practices that keep our children safe. The review panel carefully considered every angle of this issue over 7 months. Their work included a thorough review of the relevant legislation, regulations, and inspection processes, as well as an engagement with people involved in the outbreak. The review panel produced a report with 12 primary recommendations and 27 sub-recommendations for strengthening food safety in Alberta's licensed childcare facilities and the kitchens that serve them. These recommendations include promoting a culture of food safety, making improvements to legislation and inspection systems for food safety, and establishing new major investigations protocols with consequences for operators who've been found to have repeat violations, and supporting better system alignment and integration in our food safety system. I do have to thank the panel members for their work and their dedication to this critical task. It's exactly the kind of thorough, solutions-oriented analysis I expected when appointing a 40-year law enforcement veteran to chair the review panel. Since receiving the report, our government has been studying its recommendations carefully. We will be acting on some of the recommendations immediately. Some will require us to change existing laws and regulations, and others will require more considerations so we fully understand how they'll impact childcare operators, food service operators, and families. But let me be clear, it's our government's intention to act on every recommendation we can to protect the children's safety and to restore trust in the system. Thanks to the members of the review panel, what we have here is a detailed roadmap for improving food safety in Alberta, and those improvements to policies are exactly what we'll deliver. Now I'd like to invite Minister Adriana LaGrange to share more.
Thank you, Premier, and good afternoon, everyone. Thank you for joining me in Calgary today for this important update on the work our government is doing to improve food safety and better protect children in licensed childcare facilities across Alberta. Last fall, Calgary experienced an unprecedented E. coli outbreak across multiple licensed childcare facilities in the community. For many families, this was an extraordinarily difficult period, marked by weeks of uncertainty and fear and distress as parents face the unimaginable challenge of watching their children struggle with serious infection. And I had a chance to talk to some of those parents, and it was heartbreaking to watch what they had to go through. The outbreak lasted 51 days, affecting 17 licensed childcare facilities. This resulted in a total of 448 cases of E. coli linked to the outbreak, with 39 individuals, including 38 children, being admitted to hospital. This crisis underscored the critical importance of food safety. Acting swiftly, Premier Smith tasked Minister Jones and myself with finding solutions to prevent a crisis of this magnitude from happening again. We acted quickly and established the Food Safety and Licensed Facility-Based Child Care Review Panel, comprised of experts with knowledge of licensed facility-based childcare, food service establishments, and best practices in food safety, public health, and clinical management of E. coli in children. Their mandate was to thoroughly examine all the details and circumstances surrounding the outbreak and propose recommendations to strengthen legislation and improve inspection processes governing food safety in licensed childcare facilities and the kitchens that serve them. The review panel has deliberated and analyzed all relevant legislation, regulations, standards, and guidelines, including the Public Health Act, Food Regulation, Institutions Regulation, and the Early Learning and Child Care Act and Regulation. This past spring, the review panel shifted focus and held a series of engagement activities to gather additional insights from affected families, affected child care providers, subject matter experts, organizations and associations, and the general public. This collaborative approach ensured that the recommendations would be both practical and effective. Through these sessions, we learned that parents and operators want children to be in an environment where food handling practices are consistently followed, and parents also stressed the importance of reestablishing trust within the food safety system. I am pleased to announce that the review panel has completed its assessment. After 7 months of thorough work and stakeholder engagement, they have proposed 12 primary recommendations and 27 sub-recommendations. These recommendations focus on 3 key themes. Fostering a culture of food safety that supports high-quality, safe, and healthy learning environments for children, enhancing public policy, legislation, and inspection systems for food safety, and improving system alignment and integration. So these themes are crucial for guiding the recommendations under consideration and in shaping a food safety system that is trustworthy, accountable, and centered on the needs of families and their children. So work will begin immediately to implement several recommendations, including establishing clear expectations and frameworks for public health inspections. Work has already begun to increase the frequency of public health inspections and to improve response times in childcare facilities with food safety concerns. Planning is underway to implement the recommendation to raise awareness of reporting mechanisms for parents and staff, enabling them to report food safety concerns and unsafe handling, as well as unsafe handling practices within licensed childcare facilities and food establishments serving these facilities. So this will also include the option for anonymous reporting, and we know how important that is. Additionally, planning is underway to require all licensed childcare providers to prominently display their most recent public health inspection reports in a place where parents and guardians can easily see them when dropping off or picking up their children. So these recommendations are thorough and provide us a roadmap by which we can start to make changes that will improve food safety and better protect young Albertans in childcare facilities. It's important we get this work right and are thoughtful in how we implement these important recommendations so that we can protect the health and well-being of children now and into the future. The approach we are taking prioritizes immediate actions to enhance food safety in licensed childcare facilities, while also considering longer-term recommendations requiring further analysis. We understand that some recommendations may affect the broader food service industry, and we are committed to engaging with stakeholders throughout the implementation process to ensure that we get it right. In closing, I want to express my sincere gratitude to Rick Hansen for his leadership in this initiative. He and his team have done an outstanding job. This work has not only been about understanding and analyzing the outbreak response, but also about laying the groundwork for long-lasting improvements. Your team's dedication, Rick, to this cause will help ensure that our licensed childcare facilities and the kitchens that serve them are not only compliant with the highest food safety standards, but also serve as a model of excellence in this industry. So thank you again, Rick and team. And I now invite Minister of Jobs, Economy and Trade, Matt Jones, to the podium.
Good afternoon, everyone. It's an honor to be here alongside Premier, Minister LaGrange and Rick Hansen, as well as representatives from Alberta Health Services, who have all worked hard in shaping how we move forward after the devastating E. coli outbreak in September of last year. An outbreak that impacted families, their children, and called into question food safety and licensed childcare facilities and the standards we have in place to prevent devastating events like this. The safety of our children is our government's top priority. Moving forward, Alberta's government is focused on restoring that trust so parents can go to work or pursue an education while feeling confident that their children are safe in our licensed childcare facilities. Since its formation, the Food Safety and License Facility-Based Review Panel met with parents and various food safety experts from across the province. In doing so, they have been able to collect information and feedback to develop recommendations to improve food safety. I want to thank everyone who took the time to meet with the panel, to discuss their concerns and share ideas. I also want to thank the panel members for participating in this critical review. Your contributions will help to restore trust in our food safety and childcare systems and protect our children. After receiving the panel's report and recommendations, our government moved quickly to develop an implementation plan. We will immediately start implementing measures to improve the safety of children in licensed facility-based childcare. This includes several measures with a focus on promoting a culture of food safety in licensed childcare. Food safety culture will be addressed through the introduction of mandatory staff training, increased transparency of food safety compliance through prominent posting of public health inspection reports, and creating awareness among parents and staff on how they can report safety concerns, including anonymously. We will work with our colleagues in Alberta Health to develop a process to require staff and volunteers to sign statements on food safety culture as part of their ongoing training. In addition, we will ensure our childcare operators have the tools they need to action these recommendations and will collaborate with our partners to develop the resources required to assist them in adhering to policies and best practices. We are also examining potential legislative and regulatory changes to strengthen our food safety standards while introducing penalties for non-compliant parties to ensure adherence to the high-quality standards expected in the sector. We will work with childcare providers throughout this process while also investing in increased risk-informed monitoring and inspections. It is crucial we get this work right and are thoughtful in how we implement the important recommendations. We must protect the health and well-being of children in the future. Our approach prioritizes immediate actions to enhance food safety and licensed childcare while also considering long-term recommendations that will take some time to implement. We will have more to say on those in the coming weeks and months. If at any time you have a concern about food safety, I encourage you to reach out to Environment Public Health at albertahealthservices.ca/EPH. Again, I would like to thank the panel members for their important work in developing the report and for providing recommendations on how we can improve food safety in childcare settings. Working together with our partners in Alberta Health and AHS, I'm confident we can develop a food safety culture in childcare that both families and providers can be proud of. I will now turn it over to Rick Hansen to provide his remarks. Thank you.
Thanks, Minister. Good afternoon, everyone, and thank you for taking the time to be here today. What happened to so many children and families due to the September 2023 Calgary E. coli outbreak remains heartbreaking. For many, the impacts of this heartbreak are still enduring today and will be into the future. As a review panel, we acknowledge the challenges and difficulties faced by all families impacted by this outbreak. The disruption to their lives beyond the health concerns was significant and long-lasting. This fact became central to our deliberations and drove our efforts to put forth recommendations that aim to restore security and trust in food safety systems in childcare facilities across Alberta. Our mandate was to provide the Government of Alberta with recommendations on how applicable legislation regulations, standards, guidelines, and operating procedures could be strengthened to assure food safety for children in licensed child care facilities and the kitchens that serve these programs. In fulfilling our mandate, we endeavored to complete a broad review that included subject matter experts, input from stakeholders, literature, and legislative review, as well as engagement with affected families. We are profoundly grateful to everyone who contributed to the fulfillment of our mandate, which shaped the recommendations and findings included in this report. In particular, the time and thoughtful contributions of affected family members who participated in engagement opportunities was vital to the review. Through our review, we learned that the food safety expectations of Albertans are not being met. The system responsible for food safety needs significant update and reform. What you will see in the report is a series of recommendations that will provide a roadmap to create a safe and effective food safety system. This is a system where fostering a culture of food safety is essential, but where serious violations of food safety regulations can result in immediate penalties and where inspection and investigative capacity is enhanced. The implementation of some of these recommendations will require changes in legislation. However, some recommendations require only changes to process. As you heard earlier, these changes can occur more quickly. As a review panel, we feel confident that the recommendations in our report reflect the lessons learned from the outbreak and provide a path forward for improved food safety. And finally, as chair, I want to take a moment to sincerely thank review panel members Shannon Durham, Leslie Encino, Dr. Jim Kellner, Dr. Lynn McMullen, and Tyler Shapka for their commitment to this work. All are recognized experts in their field who selflessly committed their time and valuable knowledge and insight in the report and recommendations. If they were here today, they would also want me to thank the Premier and the two ministers, Minister LaGrange and Minister Jones, for giving us, the panel, the opportunity to look at something that was tragic and caused grief and heartbreak to a whole lot of people. But the direction we got was to find out how we could ever prevent this from happening again. All the panel members, to a person, greatly appreciated the opportunity that you gave them. They did not take that for granted. So thank you so much. It's greatly appreciated. And thank you for being here today.
Thank you. We'll now go to our media Q&A. We'll start off with questions here in the room before making our way to the phone lines. Just a reminder for those on the phone, we also have Dr. Laura McDonald here available for questions. And we'll start off with our first at the mic. Go ahead.
Hi there. Question for the Premier, if you please. Just speaking with some of the parents in their reaction, I understand that you guys were able to provide them with their own briefing this morning. Mm-hmm. You know, I know that a lot of this review had focused on food safety. They say that it's the child care system that's broken and that failed them, and they point to being, you know, asked, for example, to sign something waiving a provider's liability for their child's health and safety while in their care. Is there enough oversight that's happening of the child care system? Is it broken, and did it fail kids in this respect?
Look, I'll have Minister Jones respond to that.
Thank you, Premier. And certainly this situation did rock people's trust in the system. What I would say is that we have over 100,000 children in care every day, and that the vast majority of operators are committed to their health, safety, and well-being. In some cases, we do see incidents where operators or perhaps their staff members do not consistently implement a culture of food safety in their work. And that's why it's important, why the panel's recommendations are so important, so that we as government can improve the standards. We can raise the bar even higher, and we already have high standards, but we are going to raise the bar even higher. We are going to put in tools to hold people accountable, and we're going to increase transparency so that parents can see an operator's track record. How was their previous health inspection? Do I trust this operator to care for my child? Do I trust this operator to feed my child? This is information that they will have. And I can assure you, as Minister responsible for childcare, we are going to hold those accountable who don't protect children. So that's my message. Again, I believe the vast majority of providers do this every day. That's why this outbreak, while tragic, this is the first outbreak of this magnitude in Alberta's history. So I do believe the system is committed to working with us to improve safety across the board, and we will have additional measures in place to hold those accountable who don't. Thank you.
Question for Mr. Hansen, if possible. I'm just looking for you to expand again on an inclusion within this report about uninspected meat. And can you talk about why this was included and what it means that the WGS profile of those two cases that were referenced within those clusters in Alberta and other provinces matched the Calgary childcare facilities
Sure.
outbreak?
And that's a really good question. When we got into this, we had great support from the Ministry of Health, and we got to look at a lot of things that are going on in the province. And we soon came to realize that you cannot limit recommendations that create safety for child care facilities in and of themselves. You could, but they would be only a few, and they wouldn't address the root cause of some of the issues that are going on. Root causes that, frankly, were unpredictable and we were unaware of when we began our work here. So as we got into it, we realized if we wanted to have any assurance that we were looking at making childcare facilities and kitchens, centralized kitchens safe, we better look upstream. Where's the food coming from? How is it getting into places? How is uninspected meat and other products making it into the food chain? So that prompted us to really expand our research. We brought in experts like the RCMP livestock folks, heard from Alberta Agriculture, some of the challenges they're facing. And we learned that without addressing the sale and the production of food products, we couldn't assure people that it wouldn't impact the downstream end of things. So we had to look at illegal abattoirs. We need to look at what was going on in particularly rural areas in the province where we learned that there are individuals who are avoiding regulations around safe harvesting of meat and processing and butchering of meat, purposely ignoring the rules, purposely operating outside of areas where they can be regulated, where they can be inspected, and learning that meat is finding its way into the two big cities and other jurisdictions. And people are unaware at times that they're potentially purchasing meat that has not gone through a proper inspection process. So we wanted to make sure that we looked at everything, not just limiting it to a small piece at the end of the food chain, but what's going on farther upstream that needs to be addressed in an environment where people, frankly, are looking to cut costs or they're looking for a good deal. And I don't want anybody in here to think that this is just what happened when, my dad used to go to my uncle and buy a quarter of a beef off the farm and take it in and get it butchered. That still happens, and that's not what this is about. This is about people who know that they're obtaining animals illegally in some cases. They're processing them in an illegal manner under the most unsanitary conditions you can imagine. And then they're packaging them up and they're selling them to people. And the average person would be unaware, and we realized that, and through the media, taking the opportunity to say, hey, you know what? You better watch where you're getting your meat products from. Because at the end of the day, there's a trust that has to exist. And it doesn't matter how well Alberta Health and the public health inspectors do their job. If there are people that are avoiding that, then there's always going to be risks. Our recommendations hope to reduce that risk. So I hope that answers your question.
But we don't know where this meat was sourced.
Not in this case, no, not at all.
And was that just not cooperative?
No.
On the part of the people who had bought it or sourced it?
Well, and I'd have to turn over to Dr. McDougall to talk about the investigation. But the investigation by the public health inspectors was thorough, given the authorities they have and the circumstances within which they went in to conduct the investigation. But there was no direct link to the source of the E. coli that found its way into the daycare.
Thanks very much. When the outbreak first started, Alberta Health Services as a group took this very, very seriously. the teams were looking after patients and families in the emergency room and in clinical settings. But the other two key priorities were trying to stem transmission, understanding where this was coming from and ensuring that this wasn't going into other parts of the community, as well as then really trying to understand the source. Part of that understanding of the source was working with the lab to identify any other E. coli cases that were occurring across Alberta. And it was actually in that part of the investigation that we were able to identify that looking at the genetics of 11 cases that were also in Alberta at the same time, but were unconnected to the outbreak, shared the same genetic fingerprint as all of the cases in the outbreak. So we know that there's a connection between some cases and what happened in the outbreak, but we don't yet know how those are actually connected. Through the course of that, investigating those 11 cases, we were able to identify that 4 of them were in fact had a very recent history of consuming privately sold or privately procured meat. And that's as far as we're able to make that connection.
Thank you. We'll go to our next at the mic.
Terry Fikowski with CTV News. Just to kind of follow up on that, it might be a bit redundant, but do we know then where the meat from the daycare came from?
Yes, so there was a very fulsome look back that included the Canadian Food Inspection Agency that was able to take a look again at the sales of and the receipts of all of the beef that had actually come into that centralized kitchen. And from all of the receipts and from all of the evidence, that was all through an inspected meat source. So what exactly that connection is of this other circulating strain and the daycare and the kitchen connected to them, that's what still remains unknown.
Okay, thank you. And just to follow up on the inspections, increased inspections, and being able to enforce for more serious violations, from reports that are out there, even from AHS, like internally, is that we're already failing to meet all of our inspections. I'm just wondering, for the province, how confident are you in increasing inspections? Will that come with hiring additional inspectors, increased funding?
So certainly we recognize that we need to step this up even further. AHS has already started to, and I'll have Dr. McDougall speak to what they've already started. But we are also looking at expanding the capacity of those inspectors. As Rick Hansen had indicated, we want to elevate that capacity so that should something come again at some point in time, that they would have be able to do those increased inspections, those detailed inspections, much like you would see in law enforcement when there's a scene that has happened, that they can go in. What also was difficult for AHS inspectors to deal with was the fact that there was some of the evidence wasn't preserved that should have or could have been preserved had there been a detailed inspector with a different lens looking at this particular situation. But Dr. McDougall perhaps could tell you how they've stepped up in the interim until we get that increased capacity within the system.
Thanks very much. So all of the licensed childcare facilities are all ranked according to the risk to the public and the people who they serve in terms of being low, medium, or high risk. And our target has been to inspect all of the medium and the high risk facilities at least once a year. Many wind up being inspected more frequently if there's complaints or for coming back to check on violations that might have been already issued. During the pandemic, the inspectors clearly got a little bit behind in terms of all of the other work that was underway at the moment. And there's been work underway now to get caught up on those. So in the last year, in 2023 to 2024, of the medium and high risk facilities, about 91% of them had at least one inspection. We're on track and absolutely committed for this year and going forward that they will all be inspected at least once a year.
Thank you.
Hannah Said with City News. Question for Rick Hansen. These recommendations are based on obviously some assumption as part of the investigation. What are those assumptions? Because we do not know the actual reason for the E. coli outbreak, but you must have some assumptions that you base these recommendations on.
Sure. As you heard, the investigation up to this point of the contamination, the outbreak, hasn't drawn a clear link back to the daycares. But it's a risk assessment. You have to look at, when you go into any investigation, when something goes from an inspection to an investigation, you start broadening what the perspective might look like. What are the outside factors that could have contributed to this? So as a result, we started asking the question. And we learned in asking questions that there's risks out in the community that create the risk that saw itself manifesting with this outbreak. So it was purely based on our mandate to look at the incident that occurred and to make recommendations that would work towards preventing an incident like this from happening again. So we didn't take a narrow view as to if we couldn't link A to B, then our job was done. Not much we can recommend. But we went well beyond that and looked at everything from the culture of food safety, which has been specified here today. It's really important. I mean, owners and operators have to take responsibility for the quality of the product that they sell to people. And everyone that works in one of those facilities has to take ownership of that. And it was mentioned about even the tip line. I mean, I suspect that within a lot of operations, there's those that don't like what they see happening in their facility, but they have no way to bring it forward without risking their job. So that's included in there. We also knew that there needed to be a clear path to enforcement and prosecution. That led to the recommendations about changing the legislation, the regulations, so that it's clear that when you have a chronic offender or somebody who's just disregarding or dismissing the laws that applies, there's an option now for public health inspectors to go in there and lay specific charges with specific fines and specific outcomes that require you to go to court and be held accountable. And then the third piece is about there has to be, which led to our recommendations, was how do you get all the agencies responsible within the food safety chain, and that includes local police. How do you get them to operate in a coordinated, integrated fashion? And our recommendations talked about how there has to be memorandums in place, memorandums of understanding that describes how these entities responsible for food safety are going to work together so that there's information shared ahead of time, that the authorities that one agency has will assist another agency where they have specialized authorities. And in doing that, you do two things. You're going to maximize the likelihood that in future events, you're going to find out exactly what happened and what occurred and where the outbreak came from. And number two, which is equally as important, is that for those people who choose to dismiss the rules as they stand and choose to move forward because there's a profit margin for selling uninspected food, uninspected meat in particular, they're accountable, there's an outcome, and the message will be sent for those that are considering it themselves, that are considering whether they should purchase products that they know didn't come from an inspected facility and a sanitary facility. So at the end of the day, we took the broad range because we wanted to make sure that everything that we could identify that created the risk was addressed so that that risk could be, I'll never say eliminated because you can't in our world today, but reduced significantly.
So if I've understood it correctly, in this E. coli outbreak, it was the central kitchen, but we do not know the source, so you based it all around the possibility.
So we had to look at, every possibility that existed out there that we could impact with our recommendations to make the food chain safer.
My follow-up question. I have two kids who are in the daycare. I don't know how the daycare deals with all the food that they're given. What goes on in their kitchen is not something parents are exposed to. So how do you expect parents to anonymously give tips to AHS after their kids fall sick? Like, how do we determine it might be food poisoning at the daycare?
So I would never expect parents to have to rely on an anonymous tip line, but I would expect that those that are employed employed who are working within a daycare or any kitchen who are seeing unsafe practices as a matter of general management, they need to feel safe that they can alert the authorities that something's going on where they work and not risk their job. So that is about those people. As far as for those folks that have their children in daycares, that's why we came up with the recommendation, and it came up and we heard it from the families that were impacted. They said, why weren't every previous inspection posted in a conspicuous spot so when they walked in to drop off their children, right there on the door, right there in plain view, results of latest health inspection. And like so many of them said to us, you give us the information, we'll make our own decisions about how we follow up on that. So that's the two-pronged approach that we heard. And the one about giving parents the information that allows them to make good, solid decisions was key to that recommendation and the series of recommendations around that.
Right, thank you.
Hannah.
Oh.
Thanks, Rick. I would just add that we're also looking at outside food policies, so the child care providers have policies in place and processes for how they handle food. Again, we're looking at commitments from providers and their staff on maintaining a culture of food safety. I would think this could be shared publicly, prominently with parents so that they can take that in conjunction with the public health inspection history and make an informed decision. So that's the transparency piece. It also assists with the accountability. And I think that's the best way to give parents the ability to make the best decision. It's also going to serve as a check and balance on the system. I've got 4 children myself. If I was dropping them off at a licensed child care provider and I saw a checkered history of repeated health or food safety related violations, I'm unlikely to leave my child there. So I think that in itself is a very powerful tool. So thank you.
Thank you.
I guess the other aspect is that in this province, we make every person who serves alcohol take a ProServe course so that they know how to safely serve alcohol. It's $25. It's online. Food safe courses are offered at anywhere from $60 to $300. And that would be the next step of how we implement that so that every person who handles food knows how to deal and deliver food safely. And it's a good course. It talks about where you get your product from, how you do proper washing so that you're not cross-contaminating, how you cook to a certain temperature to ensure that you're killing potential pathogens, how you transport at a certain temperature to make sure they don't multiply, how quickly you have to make sure you refrigerate food afterwards, if it needs to be reheated, how you reheat and to what temperature. So all of those things are going to be taught in a course. So any person who is dealing in food handling will have that available. That'll give that extra measure of confidence to parents as well.
Thank you so much.
And we're going to take a few questions from the phones first before trying to come back to the room here. Operator, could you put through our first caller, please?
Your first question is from the line of Don Braid from the Calgary Health. Your line is open.
Hi, thanks for taking my call. Premier, I just wanted to ask you, you've expressed discontent with AHS in the past. We all know that. You've brought in structural changes. Now, this was an AHS operation from beginning to end, the inspections, and it begins to look from the reporting as if this was not a well-organized, effective system, that the inspectors were harried, overworked, understaffed. Some 6,000 places weren't inspected in 1 year. There's not much blame placed on anybody in this report, but how do you feel about what this says about AHS's performance and your actions in the case of AHS?
Well, as you know, I think that AHS should focus on hospital services, and I think that they did a tremendous job when the cases started showing up at hospital, leaping into action and caring for all of those children. The fact that there were no deaths, 39 hospitalized, the constant testing that was done, and the ongoing care that they're going to give, absolutely tremendous performance by Alberta Health Services and the hospital in particular. When it comes to this role of public health inspection, food inspection offices, going into childcare operations, going into restaurants, I've had a conversation with my health minister. Is this under our new refocusing? Is this really Alberta Health Services' job? or is it Alberta Health's job? So we haven't made a decision yet about reorienting that department, but for some of the implementation of the decisions that we're talking about, especially if an inspector shows up and realizes that they have to switch into investigating a crime scene, that will require integration with Mike Ellis's Department in Public Safety and Emergency Services. So, look, everyone did the best they could under the environment that they did with the circumstances that they had, but I think we have to have that broader conversation. Let's just make sure that our hospitals are focused on the hospital care, and let's make sure that these agencies that have to operate between multiple jurisdictions. My view is that it might be more appropriate to move it to Alberta Health and make sure that we don't end up with any lines of communication that are crossed, so that we can also more effectively implement the investigations arm. I don't know if you want to comment on that, or? I think you covered it.
And a follow-up, Don?
Premier, are you going to rename Alberta Health Services Alberta Hospital Services? Are you actually going to do that? I mean, you won't have to change the letterhead too much.
I contemplated that, but I have been told it would be a very expensive rebranding exercise, especially when you think about how many facilities they operate, how many business cards and letterhead. I would rather see those dollars go to improving frontline care. So I just want people to know our framework for the reforms that we're doing is to really get AHS focused on delivering hospital care, surgical care, emergency care to the very best of their ability.
Thanks, Don. Operator, could you put through our next caller, please?
Please.
In regard to Don's.
Yeah.
Next question from the line of Kelly Kreiderman.
Yeah, just if I could say something in regard to Don's question about a lack of accountability in that report. I have to tell you, the easiest thing for any panel to do is look at the last person to touch the ball and say, let's throw him under the bus or her under the bus. There was inspectors who for years have taken on the philosophy, public health inspectors, that it's about education and it's about getting compliance. And they go out there, and a lot of them do a really good job doing that. Most of them are hugely committed to it. It's about doing an inspection, getting voluntary compliance, and prevention. In this case, we learned that the offenses, the violations they found, they followed up on, the violations were corrected in a reasonable time. Could it have been done better from the perspective of the parents should have been made available? Absolutely. But when you look at the thousands of inspections that followed the same philosophy about let's go in there, let's inspect, let's fix what's if it's not fix it and prevent, then it's not fair that when there's a huge backlash, a bad outcome that occurs, that we go to the last person who touched the file and then hold that person responsible. That's why we looked well beyond the simple solutions to what else should be done to address the issue. So I just felt that I had to answer that particular piece of the equation, people didn't think that somehow there was negligence on the part of the inspector in not taking the steps forward. That led to our recommendations to include changing legislation so that if you believe somebody is overtly or somebody's creating is a chronic offender, then there's a clear path to the charge, the way the person's to be charged, what the fine is going to be, whether it's a court appearance, and getting that person into court. Currently, that's not there, where it's clear. And that currently, and in the future, that's what these recommendations are about, is changing that piece so that there is other options available to holding people accountable.
Perfect. Thanks, Rick. Operator, could you put through the next caller now, which I believe is Kelly Kreiderman?
Kelly Kreiderman, your line is now open for the question.
Or the minister, you talk about addressing these issues in future, but should parents be concerned that we don't have a timeline on when the changes will be made? You're talking about consultation, you're talking about the need for legislation. What can concerned parents look forward to even this fall in terms of action on this file, 1 year away from, as you said, this crisis?
Well, I would say that some is going to be implemented right away, and I'll get both the ministers to talk to that. The issues that Chair Hansen just brought up about having consequences and investigatory powers built into legislation, that requires a legislative change. You can't just implement that. There has to be a process that you go through, and you know how our legislative process works. We'll have to see if we have the ability to draft something up for implementation this fall, or if it would have to be in the spring. And then there's also the other question of what kind of additional training do we need to give for food being brought from home. And Minister Jones talked about that. We'll have to do some consultation on that, because when somebody sends a brown bag lunch with their child, is that going to have the same level of food handling practice requirements as somebody cooking in a commercial kitchen? We have to be nuanced about this. We don't want to create a bunch of additional rules on certain types of actions if it's unwarranted. We absolutely want to implement the commercial kitchen, but we have to sort of figure out from parents and from daycare operators what they think the appropriate level of training, awareness, permitting, accountability would be when we bring in outside food from parents packing a lunch for their kids. So that's why it's sort of in 3 different phases. One phase we can implement right away, one that will require legislation, hopefully this fall, but perhaps in the spring, and then the last piece that will require some consultation just to make sure that we already know that we have regulatory requirements on our operators. We want to make sure that we're implementing these policies in a way that isn't overly burdensome and achieves the goal that we want. Let me get Minister LaGrange to talk about those different phases from her perspective, and then Minister Jones.
Thank you, Premier. And I think Premier did a great job of saying that that's exactly it. We're analyzing the recommendations. We are starting to put them in the buckets that they belong in: immediate, moderate, medium, and long term. And as we continue to move forward, we will absolutely implement those that we can immediately. We've already mentioned some, including the process pieces of having the most recent inspection put on a door that a parent can see very quickly. I also want to remind everyone that the recommendations, while they were around childcare centres, they have broader implications for the whole system. And we want to create a culture of food safety for the whole system, because it's not lost on us that this could have happened in a senior's home. This could have happened in a school. So we have to really look at all of the broader implications and how we can improve food safety throughout the whole healthcare system. Minister Jones?
Yeah, I would just add that the ultimate success of these improvements, these recommendations, these reforms, is going to be in collaboration and compliance. We can have the strictest measures and legislation in the world, and if there isn't that culture of food safety, you're still going to have the potential for foodborne illness and outbreaks because of people disregarding those high standards in that legislation. So I think it's critical that we implement everything we can immediately that we can. While those things that require collaboration and consultation, we take the time to work with our partners, both in the food side and the child care side, to implement them in a way that they will buy in. We need buy-in to a culture of food safety, and so we're going to involve those who have to buy in that process. Thank you.
Thank you. And did you have a follow-up, Kelly?
Yes, this is for the Premier. Given the importance of the province's agriculture industry and its beef industry, are you concerned that we still don't know the source of this E. coli strain, and will you ask agriculture to speed up that investigation?
Well, I've been watching how there have been a number of cases where uninspected meat was found to have been served in private facilities, and I've watched how the different investigation arms have worked together on that. I think we do continue to have to investigate how widespread that is, and make sure that that our laws are in sync, so that there is also some accountability around that. I can maybe turn it over to Chair Hansen, and he'll tell you a little bit more about how they integrated with agriculture when they discovered that may be one of the aspects that they had to look at.
Yeah, it was really gratifying to hear how already there's efforts being made to integrate how investigations are now conducted in the province. Our SMP livestock folks, the Alberta ag folks, and others who are now working more closely together to really target the perpetrators. There's people out there that do this on a regular basis. And I can tell you one thing that was really gratifying, again, from our perspective, is that the livestock producers in this province are incredible. I heard that from our CMP livestock investigators. I've heard it from others, and they were hugely supportive of providing information when they could, when they got knowledge of some of these illegal abattoirs that were operating in any proximity to their farms and ranches. So it's the genesis of a really good system is there. It's not like there was criminal neglect occurring in all parts of the food safety chain on a daily basis. But what there was individuals who were trying to take advantage of the gaps that existed. And if there's one thing that, and I know it sounds corny, but it made me proud to be an Albertan, was when I saw what one rancher did, the lengths he went to obtain really usable information that was actionable by those enforcement agencies that had to take his information and take it forward into a prosecution. It was really gratifying. So was that a concern we looked at? Absolutely. But I can tell you that the food safety, the folks involved in the food safety chain, especially the producers, the farmers and ranchers, hugely cooperative and hugely engaged in anything that can be done to make their product a safer product when it gets into the global market.
Thank you. We have time for one more quick question. Operator, could you put through our next caller, please?
Hello.
Can we put through our next caller, please? One more question.
Our next question is from the line of Terry Reith from CBC News. Terry, please go ahead.
Yes, hi, good afternoon, and thank you so much for taking my question. First, for Dr. McDougall, what are the chances of a strain of DNA sharing the same fingerprint as the one found in the E. coli and the one found in the uninspected meat? What are the chances of those occurring naturally, or is there a good case to link those?
Thanks for that great question. There's a system that exists in Alberta and across the whole country that does that DNA testing of E. coli and looks for any similar pattern that could have happened in other provinces in previous years and even into the United States. And there are very, very few E. coli isolates that have had that same genetic fingerprint as the ones that were detected here. There were 5 from another province, also in that same year. And other than that, I think there was 1 several years ago from a state in the United States. So the likelihood of this happening randomly and not having a connection of some kind is pretty remote.
Right. And did you have a follow-up, Terry?
Yes, I sure do. And back to Mr. Hansen, and any others who want to weigh in, we know that uninspected meat is making it into businesses. How will the province beef up its rules to better protect consumers on this front?
Well, we'll take the advice of Chair Hansen as we go through this. But it does seem to me that we already have, based on what he discovered during the investigations, we already do have an investigation team within agriculture. I think perhaps the solution is to do, if we find other instances like this, the same kind of cross-ministry collaboration, where we would be able to do some surveillance and be able to get the health inspectors to give the information that they have, and then ensure that we're sending in agriculture to do the full investigation. I think that's what I am hearing from this report, is that bringing an operator into compliance has been the mandate and approach with Alberta Health Services as they've been going through analyzing all of the food safety practices at all of the different establishments that they oversee. However, if something steps over the line into where needing a prosecution, that's a piece that we need to build, and we'll build those connections with what we already have as a starting point. But I suspect what you'll see is that agriculture will continue to play a larger role, and we'll have more integration between the inspectors and agriculture if something does rise to that level that there needs to be an investigation.
All right. And with that, that's all the time we have for questions today. Thank
Excellent.
you, everybody,
Thanks, everyone.
for joining us.